Everyone often asks me, how can someone increase the size of their penis? Well, I'm Dr. Rena, a urologist and pelvic surgeon, and today I'm going to discuss a method known as Jelqing. If you search the internet for Jelqing, you'll come across hundreds of videos and articles about it. But what exactly is it, and does it really help increase penile size? Jelqing is a technique where a person uses their forefinger and thumb to form an OK sign, and then slowly moves that grip along the penis while it is in a semi-erect state, starting from the base and moving upward. The idea behind this method is that stretching the penis may cause tiny micro-tears in the tissue, which later heal by forming new cells. Some people believe this healing process could possibly create minor scarring and make the penis appear slightly larger. Another theory is that this practice may increase blood flow to the penis. However, the real question is, does it actually work? At this point, there are no strong scientific studies that clearly support this claim. One very small study conducted by a penile pump company examined Jelqing exercises in 7 men and found that it didn't change penile length at all. But that study wasn't designed very rigorously from a scientific standpoint, so it isn't something I would rely on heavily. What's important to understand is that Jelqing can potentially cause permanent damage to the penis if done improperly. By permanent damage, I mean that it can lead to penile numbness if the nerves in the penis are injured. The repeated stretching may also damage the arteries and veins, and that kind of injury can result in erectile dysfunction. In other words, something you might try to improve sexual performance or appearance could actually end up doing more harm than good. On top of that, people may also experience bruising, skin irritation, and pain from performing these exercises. Let me share a couple of studies that give us some insight into what can happen when Jelqing goes wrong. Again, there isn't solid research showing benefits, but there are reports describing complications. One study followed 37 men over an 11-year period who came to a clinic because they developed erectile dysfunction after practicing Jelqing. Ultrasound tests were performed on their penises to evaluate blood flow, and many were found to have veno-occlusive dysfunction. This means the blood vessels in the penis were not working properly to allow the penis to fill with blood and then relax, both of which are necessary for a normal erection. Even though we don't know how many total patients the clinic saw during those 11 years, 37 men experiencing this issue is still significant. Another study examined 3 men who had different types of unusual masturbation habits. One practiced prone masturbation, which means lying on the stomach while masturbating. Another relied on the water jets in a hot tub for stimulation. The third individual practiced Jelqing. All 3 men underwent Doppler penile ultrasounds, and doctors found signs of injury to the penis related to these habits, which ultimately led to erectile dysfunction. In addition, the man who practiced Jelqing developed a visible penile deformity. So my main takeaway for you is this: risking an injury that could lead to erectile dysfunction, numbness, or even a disfigured penis simply isn't worth it. If someone still chooses to try these kinds of techniques, they should at least proceed with extreme caution. Personally, I do not recommend Jelqing as a method to increase penile length. Thanks for watching, and as always, remember to take care of yourself, because you truly deserve it.